Common medications that can damage your kidneys. Medications are crucial for treating many health conditions. However, they can also cause not so little on their own, especially for your kidneys. Medication-induced kidney damage can be of two types: dose-dependent, where harm is related to the amount of the drug taken, or idiosyncratic, where reactions are unpredictable and not related to dosage. In this video, we'll talk about 4 common medications that can damage your kidneys, a medical condition known as nephrotoxicity. This can reduce the kidney's ability to filter blood properly, which is its primary role in the human body, and this leads to serious health concerns. As we age, our kidneys naturally become less efficient. Unfortunately, aging often necessitates taking more medications, which can complicate matters. It's vital to ensure these medications do not harm our kidneys or other organs. First on our list are non-steroidal anti-inflammatory drugs, or NSAIDs. These include familiar over-the-counter medications like ibuprofen, Advil, Motrin, and naproxen, Aleve. While they're excellent for easing pain and reducing inflammation, they can pose serious risks to your kidneys if taken in high doses or over long periods. How do NSAIDs work? NSAIDs relieve pain by inhibiting the enzymes cyclooxygenase 1 and cyclooxygenase 2. These enzymes are crucial for producing prostaglandins, substances that help protect the stomach lining and ensure proper blood flow to the kidneys. When NSAIDs reduce prostaglandin production, it can lead to decreased blood flow to the kidneys, potentially causing acute kidney injury, AKI, or chronic kidney disease, CKD. To minimize the risk of kidney damage from NSAIDs, follow dosage guidelines. Always adhere to the recommended dosage on the medication label or as advised by your doctor. Limit duration. Avoid using NSAIDs for extended periods unless your doctor advises otherwise. Stay hydrated. Drinking plenty of water can help support kidney function and reduce the risk of damage. By understanding how NSAIDs work and taking simple precautions, you can enjoy their benefits while safeguarding your kidney health. Always consult with your healthcare provider if you have any concerns or questions about using NSAIDs. Next up, antibiotics. Antibiotics are essential medications used to combat bacterial infections, ranging from common ailments like urinary tract infections, UTIs, and skin infections to more serious conditions such as pneumonia. While antibiotics like penicillin and cephalosporins are generally safe, certain types, such as aminoglycosides like gentamicin and tobramycin, are known for their nephrotoxicity, a property that can harm the kidneys. Aminoglycosides work by disrupting bacterial protein synthesis, making them effective against severe infections. However, they can also cause direct damage to the renal tubules, the tiny structures in the kidneys responsible for filtering blood and producing urine. This damage can lead to a condition known as acute tubular necrosis, ATN, where kidney cells are injured and may die off. Symptoms of ATN include reduced urine output, fluid retention, confusion, and in severe cases, acute kidney injury, AKI. For individuals with existing kidney issues or those at higher risk of kidney damage, healthcare providers may opt for alternative antibiotics with lower nephrotoxic potential. It's crucial for patients to always follow their doctor's instructions precisely when taking antibiotics. Completing the full course of treatment as prescribed helps ensure effective bacterial eradication and reduces the risk of antibiotic resistance. Avoiding self-medication and refraining from using leftover antibiotics from previous treatments are equally important practices. Antibiotics are prescribed based on specific bacterial infections and individual health conditions. Using them improperly can lead to ineffective treatment, complications, and potential harm to kidney function. Regular monitoring of kidney function through blood tests may be recommended for patients receiving nephrotoxic antibiotics, ensuring early detection of any adverse effects and prompt intervention if necessary. By maintaining open communication with healthcare providers and adhering strictly to prescribed antibiotic regimens, patients can effectively manage infections while safeguarding their kidney health. Our third category includes ACE inhibitors, angiotensin-converting enzyme inhibitors, and ARBs, angiotensin II receptor blockers. These medications are pivotal in the management of hypertension, high blood pressure, and various heart conditions, offering significant benefits in improving cardiovascular health. Examples include widely prescribed drugs such as lisinopril, an ACE inhibitor, and losartan, an ARB. ACE inhibitors work by inhibiting the production of angiotensin II, a hormone that constricts blood vessels. By doing so, they help relax blood vessels, reduce blood pressure, and enhance blood flow throughout the body. Similarly, ARBs block the action of angiotensin II by binding to its receptors on blood vessels, resulting in vasodilation and improved blood circulation. While these medications are generally considered safe and effective, especially in preventing complications like heart attacks and strokes, they do carry potential risks for kidney health. In individuals with pre-existing kidney conditions, or in rare cases where renal artery stenosis, narrowing of the arteries supplying blood to the kidneys, is present, ACE inhibitors and ARBs can reduce blood flow to the kidneys. This reduction in kidney blood flow can lead to impaired kidney function over time, potentially progressing to kidney failure in severe cases. Regular monitoring of kidney function through blood tests is essential for patients taking ACE inhibitors or ARBs. This monitoring helps healthcare providers assess how well the kidneys are functioning and detect any early signs of kidney impairment. It's also crucial for patients to stay well hydrated, as adequate fluid intake supports kidney function and helps mitigate potential adverse effects of these medications on renal health. Patients prescribed ACE inhibitors or ARBs should maintain open communication with their healthcare providers, promptly reporting any changes in their health, including symptoms like decreased urine output, swelling in the legs or ankles, or unexplained fatigue. By working closely with their medical team and adhering to prescribed treatment plans, patients can effectively manage their blood pressure and heart conditions while minimizing risks to kidney health associated with these medications. Last but not least, proton pump inhibitors, or PPIs, commonly used to manage acid reflux and heartburn. Examples include omeprazole, Prilosec, and esomeprazole, Nexium. These medications work by blocking an enzyme in the stomach wall that produces acid, effectively reducing acid levels. While PPIs are effective in treating digestive issues, long-term use has been associated with an increased risk of chronic kidney disease. This risk primarily stems from a condition called interstitial nephritis, which is an inflammation of the kidney's tissue between the tubules. When this tissue becomes inflamed, it can impair the kidney's ability to filter blood and remove waste products, potentially leading to kidney damage over time. To minimize these risks, it's essential to use PPIs exactly as prescribed by your healthcare provider and to discuss any concerns or symptoms with them promptly. If you require long-term use of PPIs, ask your doctor about using the lowest effective dose for your condition and the shortest possible duration of treatment. Regular monitoring of kidney function through blood tests may also be recommended to detect any early signs of kidney problems. By staying informed and working closely with your healthcare team, you can effectively manage acid reflux while prioritizing your kidney health when using PPIs. So, how can you protect your kidneys while taking these medications? Here are some quick tips. Stay hydrated. Drink plenty of water every day. Follow the prescribed doses and duration. Regularly check in with your healthcare provider, especially if you have pre-existing kidney conditions. Avoid combining medications without professional guidance. Your kidneys work hard to keep you healthy, so it's important to take care of them. If you have any concerns about the medications you're taking, don't hesitate to talk to your doctor. Thanks for watching, and if you found this video helpful, please give it a thumbs up and share it with your friends and family. Don't forget to subscribe for more health tips and stay healthy.